Nasal polyp. So, what are nasal polyp? Nasal polyps are prolapsed pedunculated part of edematous mucosa of nose and paranasal sinuses. They are non-cancerous growth. Now, what causes the nasal polyp? Mucosa helps protects inside of your nose and sinuses and humidifies the air that you breathe. So during infection or allergy, the nasal mucosa becomes swollen and red with prolonged irritation, and the mucosa may form a polyp. Pathogenesis. Nasal mucosa becomes edematous due to collection of ECF, hence due to gravity and excessive sneezing there is pedunculated nasal polyp. Predisposing factor. First is recurrent sinus infection, second asthma, third allergic rhinitis. Now, what are the symptoms of nasal polyp? Polyp can grow large enough and block the nasal passage. Symptoms include first, nasal congestion, a sensation that your nose is blocked. Second is the runny nose. Third, postnasal drip, excess mucus runs down the throat. Fourth, reduced sense of smell, that is anosmia. Fifth, snoring and mouth breathing. Sixth, headache. Seventh, the speech may also become hyponasal. Major types of nasal polyp. So there are two types of nasal polyp. First is the antrochoanal type of nasal polyp. They are single, unilateral, originate from the maxillary sinuses. They are usually found in children and infection is the common cause. Second is the ethmoidal polyp. They are multiple, bilateral, originate from ethmoid sinus, usually found in adults, and allergy is the common cause. This is the table showing the difference between the antrochoanal polyp and the ethmoidal polyp. Now, how are the nasal polyps diagnosed? It is diagnosed after asking the symptoms and examining the patient's nose. External nose may be broadened in long-standing polyps, giving a frog-like appearance. Next, by anterior rhinoscopy for diagnosing the ethmoidal polyp, as ethmoidal polyp extends forward. Then, by posterior rhinoscopy for diagnosing antrochoanal polyp, as the antrochoanal polyp extends backwards. On anterior rhinoscopy, ethmoidal polyp appears as smooth, glistening, grape-like masses, often pale in color. This is the diagram showing the ethmoidal polyp on anterior rhinoscopy and nasal endoscopy. Next, on posterior rhinoscopy, antrochoanal polyp appears as globular mass filling the choana or the nasopharynx. A large polyp may hang down behind soft palate and present in oropharynx. This is the diagram showing the procedure of posterior rhinoscopy. Now, investigation to diagnose the nasal polyp. Nasal secretion may contain eosinophil in patient having polyp due to allergy. Next is radiography. Antrochoanal polyp make maxillary sinus opaque on affected side, and ethmoidal polyp cause opacity of the ethmoidal sinus. Next, CT scan to locate nasal polyp and other abnormality linked and also any obstruction. Next, biopsy to confirm the diagnosis. Now, what are the treatment for nasal polyp? Following treatments are commonly used. First is steroids. Steroid spray or nasal drops will shrink the polyps by reducing inflammation, but recurrence is common. Second, steroid tablet in case of larger polyp or more severe inflammation. Third, other medication. It is given to treat conditions that are making inflammation worse, like antihistamines for allergies, antibiotics for bacterial infection, antifungal for fungal allergies. Next is surgery. Polypectomy. This is the most common procedure for removal of polyp. The patient is given general anesthesia. The Polyps are avulsed with snare or with the forceps. Next is sinuscopy. Endoscopic sinus surgery of polyp and sinuses has reduced the chances of recurrence of polyps. Now, scope of homeopathy. It will depend on sensitivity, susceptibility, etc. Various approaches are possible on case to case basis. Best approach will be Hahnemannian with intercurrent doses of miasmatic remedies. Rare remedies are useful when totality is unclear or failure of apparently indicated medicine. Surgical intervention may be necessary when conservative line of treatment fails, although there will be a chance of recurrence. Thank you.